Welcome everyone to my channel, which is Pharmacode. In today's Pharmacode class, I'll be telling you about the ciprofloxacin, the drug of choice for typhoid. The common available brand names of ciprofloxacin are like Novidate, ciproxin, and Ciprin. It belongs to the pharmacological class, which is quinolone, means antibiotic. It belongs to pregnancy category C, therefore not to give in pregnancy and also during lactation. It is available in tablet form like sustained or extended release form, and also in syrup, suspension, and in ophthalmic solutions as well, and otic preparation also available. Being a broad spectrum synthetic quinolone, it is used to kill gram-positive and gram-negative bacteria. And the mode of action is it inhibits the DNA gyrase, and this enzyme is involved in replication of the bacterial DNA. And the uses are like it is used for UTI and LRT, means lower respiratory tract infection, bone and joint infection, chronic bacterial prostatitis, nosocomial pneumonia, means hospital acquired pneumonia of course, and it is also used for sinusitis, post-exposure prophylaxis for anthrax, and ophthalmic solution is used in corneal ulcer. The best thing about the ciprofloxacin is it is most effective against the Pseudomonas aeruginosa. How about the contraindication of the ciprofloxacin? I mean the absolute contraindication of the ciprofloxacin. So it is absolutely contraindicated in allergy or hypersensitivity or the viral infection or history of myasthenia gravis, peripheral neuropathy, tendon pain, and in lactation. Cautiously give to the patient having seizure, myocardial ischemia, and QT prolonged in ECG, and severe stroke and severe renal impairment because crystals are formed in urine because of this. Now the doses on the basis of condition, like in uncomplicated UTI, we are supposed to give ciprofloxacin orally 250 mg every 12 hours, and if extended release tablet then 500 mg for 3 days, and if IV then 200 mg every 12 hours for 7 to 14 days. In complicated UTI 1000 mg for 7 to 14 days, and if IV then 400 mg every 12 hours for 7 to 14 days. In acute sinusitis we are supposed to give ciprofloxacin orally 500 mg for every 12 hours for 10 days, and in moderate to severe systemic infection 500 to 750 mg for every 12 hours. In case of renal impairment, adjust the dose on the basis of creatinine intolerance. Like if creatinine intolerance is 30 to 50 ml per minute, then 250 to 500 ml for every 12 hours is given. And there is no change in dose when given through IV. If less than 30 creatinine intolerance, then 250 to 500 mg for every 18 hours is given through orally. In IV, 200 to 400 mg for 24 hours is given. And the dose for conjunctivitis, bacterial conjunctivitis, is like ophthalmic solution 1 to 2 drops of ophthalmic solution for 2 hours for every next 2 days, and while the patient is awake of course, and the ointment half syringe for conjunctivitis instilled 3 times for 2 days or 12 hours for 5 days. And in case of corneal ulcer, the adult dose is like 2 drops for 15 minutes for 6 hours or 2 drops every 30 minutes for 18 hours. The adult and child dose for otitis externa, which is 0.25, apply on the affected area after 12 hours for 7 days. And don't give antacid with this drug because it decreases its absorption. And the general IV dose of ciprofloxacin is 200 ml to 400 ml. Add with normal saline or 5% dextrose for dilution, and give it slowly, over 1 hour, and don't give in small vein because if given fastly then seizure can occur. And the antacid, iron, calcium sucralfate can decrease its absorption. And the side effects are like seizure, nervousness, anxiety, nausea, vomiting, diarrhea, local burning, and the corneal crystal, peripheral neuropathy, and tendon inflammation, seizures, and there are many other as well. And monitor the PT if given along with warfarin. And if given for a long time, then CBC, LFT, and renal function tests should be done. So that was all about today's lecture, and if you like my videos, so do like and subscribe my channel, which is Pharma Coach. So thanks for watching my video.